What can I expect to happen on the day of my cataract surgery?
When you do come to the surgery center to have your cataract surgery, you should know what to expect. The first thing is, during the check-in process, they'll be verifying all the information to make sure that you're the correct patient, that we have the correct chart, and what they'll be doing is checking the plan for your surgery. That will mean the type of lens that we've chosen and that we've discussed. Once that's all verified, then you'll come back to the pre-op area. In the pre-op area, they'll get you ready for surgery. They'll have you lie down on a bed that is on rollers. At that time, they'll start eye drops that'll dilate the pupil. So that means that the vision is going to become blurry. Once the pupil has dilated well, you'll then go to the operating room on that same bed. When you go into the operating room, the first thing you're going to notice is it's extremely cold. And if you feel cold, what we do is give you another blanket. We actually have blanket warmers in the surgery center. And it's not a problem to give you another blanket if you are cold. Once you're in the operating room, you'll hear me talking. And what we'll be talking about is the procedure in detail. And I do that so that the patients are not startled by things. Most patients have never seen the operating room, especially for cataract surgery, and so they don't know what to expect. So what I'll do is tell the patient, for example, that the microscope light is extremely bright. And what we do is turn the light on slowly so the patient can get used to it. Now, some patients are not bothered by it at all. Some patients, however, will take time in order to adjust. And what we do is just wait until that patient is ready. The other thing we like to prepare patients for is we will sprinkle a sterile water solution on their eye. When we're doing this, the patient will sometimes be apprehensive or startled, so we try to warn the patient before we do it. Some patients, again, will react more than others, but usually once a patient gets used to it a couple times, they don't have a problem with it during the surgery. When we make incisions or when we're introducing instruments into the eye, a patient will feel pressure. That is normal. But a patient should not have pain. If a patient's having pain, then what we do is give them pain medicine, or we can give them sedation. And we give almost all patients sedation before we even start the procedure. Once the procedure is over, we then remove the sterile drape. The drape is very, very sticky. And what I tell each patient is that the worst part of the procedure really is taking off the drape, because it feels like your skin's coming off. It's not, but it just feels that way. And the nurses joke that they're getting a dermabrasion or something like that with their cataract surgery. But I tell the patients that that'll be the worst part of the procedure. Once it's off, though, the surgery's done. And we just put a shield or a patch and shield on the eye, depending upon the type of anesthesia the patient had.